is fairly simple, and it's 1 in 3 adults are prediabetes. Just have to look around. If it's not the person on your left or the person on your right, then it's got to be you. So you got to do something about it.
Hello, and welcome to Your Health Matters. I am your host, Vivian Nacho Ayok, pharmacist, certified diabetes care and education specialist, and founder of Sorogi. I am excited to launch this podcast that talks about education and support for people of African descent. And the first series of episodes are really going to be focused on diabetes. We are going to have conversations with healthcare providers to discuss the challenges they face in practice, listen to people who actually living with diabetes and have them share with us their stories, some of the stigma they face, challenges about nutrition, stress, and much more. We hope that these conversations will truly improve your understanding of the daily struggles of living with a condition like diabetes, provide an avenue for people to get their questions answered, and learn about small steps they can take every day to improve their health. This episode is going to be focused on diabetes prevention, and we're talking about type 2 diabetes prevention. And with us today to discuss this is Dr. Nkossi Dambita. Dr. Dambita has been a clinical director of the African American Health Program in Montgomery County, Maryland, in the US, and has been in that position for the past 6 years. He is a public health physician with over 36 years of practice and has directed multiple public health programs at local, state, and international levels. Some of the major public health projects he successfully managed included the surveillance of HIV in Maryland in the early 90s, the monitoring of bioterrorism in Baltimore County in the early 2000s, and also integrated health project in the Democratic Republic of Congo. He is now a retired faculty from Johns Hopkins University School of Medicine and extremely passionate about eliminating health disparities in the Black population, focusing on 6 priorities: cardiovascular disease, diabetes, maternal and child health, cancer education, sexual health, and mental health. Oh, I forgot to add one, oral health. I am super impressed, and I've had the opportunity to work with him. So welcome to the show, Dr. Dambita.
Thank you, Dr. Vivian. I'm very happy to be here to share whatever experience I have with your audience. Ceux qui parlent français, je vous souhaite la bienvenue à notre entretien ici avec le Dr. Vivian et je vous dis de prendre le diabète au sérieux.
Oh my goodness, you know I love every opportunity to practice my French, so I'm going to try something. J'aime chaque occasion de pratiquer mon français. How did I do?
Oh, pas mal.
Pas mal,
Wonderful.
huh?
Next time we're going to do it all in French.
There you go. That's a challenge I'm willing to take. So thank you. I am truly honored to have you join us for this episode. I mentioned we've worked on several things, which we'll get into later, but your background is really in epidemiology. So can you share with our audience, how did you become involved in chronic disease management and prevention, specifically diabetes prevention?
Thank you for the question. And as far as I'm concerned, it's a very simple trajectory. You know, once you're beaten by the public health bug, it won't let you go. And that's what happened to me. I have actually limited clinical experience, maybe 2 to 3 years And then this thing, this public health bug bit. And I decided to make it my lifetime career. Epidemiology is a pillar of public health. Everybody knows that. And what it does is to identify diseases and measure. You measure the impact on population. So I decided that my patients will be the public, the population, instead of individual. So what you want to know is a particular disease. How many people does it affect? Where do you find it? You want to know, does it have a pattern in the timing of the disease, seasonality? So those are the three pillars that you use to find out what is a major public health threat: the place, the person, and the time, PTT. So you start talking about things like incidence, prevalence, etc. So you gather data. What do you do with the data? You seek intervention. And when you look at it, I said persons, it's important. That's when you start looking at things like the age, the race, where they're from, and so on and so forth. So I decided a few years ago, actually, after dealing with the epidemics, the malaria, the HIV, bioterrorism, and all that, I came back and I said, well, listen, what is one major public health? And that, the way to look at it, it's not so much the number of people, although it's astronomical, because we're talking about the people that are affected. Probably 10% of the American population has diabetes, okay? And maybe only 25% of them know that they have diabetes. You think that's huge, right?
That is huge. That is a huge problem.
It's even huger. It's even a bigger problem when you just looking at the people that are having baby diabetes. That's pre-diabetes. I call it baby diabetes. Okay, you go to your doctor, they check you up, and they said, well, listen, you have the beginning of diabetes. So we're going to put you on metformin. You're lucky enough that they did the test and they tell you that you have prediabetes. But the total number of people that are in prediabetes in America, that's 80 million people plus.
And counting, and
And
counting.
counting, and counting. And only 10% know that they have it. So there couldn't be any bigger problem, a public health threat than that. And in addition to that, if you look at how much money, the expenditure, healthcare expenditure on that one single disease, figures go back several years, but you're talking over $250 billion per year. $250 billion per year. Okay, so yes, what do you do as an epidemiologist? You have to focus on that problem. What to do and how to prevent complications, how to prevent returns to ER, and how to reduce hospitalization and all that. That becomes a major concern. So I said, okay, I have this issue, and talking about it affects Black people, people like me, I had to do something. I got involved in this project that seeks to reduce that disparity between the Black people and the rest of the people in Montgomery County. So that's the trajectory, the trip from being an epidemiologist to now focusing on diabetes management, among other things.
You are doing an amazing work. I know you and I connected on diabetes management, but I'm thinking about my own journey. And I started out as a diabetes educator, helping people understand diabetes who already were diagnosed with diabetes and doing not so well, and helping them manage the condition just to prevent complications and just have some quality of life. But as I sit back here and think about it, I think we went about it the wrong way. I think it would have made more sense to start with diabetes prevention. But unfortunately, there is so much focus on management. It just feels like, the focus should really be on prevention. And we eventually got a diabetes prevention program. But if I had to do things over again, I think it should have been a lot more focused on diabetes prevention. Management is still important, don't get me wrong, but I'm talking about where do you begin? Where do you start? If it makes sense to focus more the initial efforts on prevention and then management. The diabetes prevention program, it's an evidence-based program that has been developed. Can you share with our listeners who might not be familiar with or hearing about diabetes prevention program, DPP, for the first time, what that is, maybe some of the research behind it, and actually participating in the diabetes prevention program?
Absolutely. DPP should be an acronym that is your friend. Everybody remember DPP, Diabetes Prevention Program. And you will hear about it. If you have not heard about it, you will. Let me tell you my personal journey in terms of prediabetes, okay? Just like everybody else, after a certain age, you have that visit with your doctor, and he tells you, I think because of my background, the clinician used the technical term, the medical term. I think you're in prediabetes. It wasn't too high. And us, well, what do we do? And at the time, remember, the thinking was if you have that baby diabetes, we'll put you on metformin. Okay? There is no time to sit down and explain all the different factors that affect diabetes and how you can reverse that risk actually. So I said, okay, there's a challenge. I'm going to go the lifestyle change route. And if that does not work, then we will look at other alternatives. Why I say that, I happened to hear about the experiment, that one of the most beautiful clinical trials that happened at the population level. People that were randomly divided into three groups. One is a control, people who are doing normal things, and the other group is people who have prediabetes and they get put on metformin. And the third group is an intervention group, the evidence-based that you're talking about. And the intervention was very simple. Okay, we're going to ask you to reduce moderate weight loss. Okay, moderate weight loss. We're going to ask you to lose about 7% of your weight at 24 weeks. 24 weeks. Then we're going to ask you to be physically active, at least 150 minutes of exercise a week. So that's if you can only manage 30 minutes a day. People don't know. People think that, okay, I have to go to the gym for half an hour. No. That's not what is recommended. Being physically active and then watching what you eat so that you can reduce your weight by between 5 and 7%. And guess what? The clinical trial didn't go to until the end. It's supposed to run for 2 years. But midway through that clinical trial, they realized that the risk of diabetes was reduced 58%. 58%. Tell me, what intervention in public health can give you this type of result? And the results are even more outstanding for people over 60 years old.
That's
You're
correct.
talking about 71% of them reduce their risk of diabetes. I heard that, and that got me motivated that I can do it. I went on to be trained as a lifestyle coach, and I started a DPP. Get tested, you know your risk, and join a DPP class.
Absolutely. Thank you so much for that. And you talked about going to the doctor and getting tested, but there's something everyone can do today, right? There is a risk assessment that anyone can take to know their risk for type 2 diabetes. And we're talking about type 2 diabetes here, not type 1, but knowing your risk for type 2 diabetes. So I know there's that really quick test that anyone can go, and we're going to put that link in the notes section here with this episode. How did you convince people to join you on this journey? Did you start with that risk assessment that anyone can do, right? It takes about 2 minutes. Or how did you go about that?
It's actually simpler than that because we're in the community. As you mentioned at the beginning, I have 6 health priorities that I'm concerned with. So myself and my staff, we are in the community all the time doing health screenings. We screened for blood pressure, we screened for glucose level, we screened for cholesterol, we check weight and so forth. That's what we do. We have set up for people with diabetes as self-management, diabetes self-management. It was easy to ask them to find some willing people to come to us. And when they come to us, we actually do blood work and determine that. But one thing I do when I go to churches sometimes to make a presentation or any outreach activity, I have a finger test where actually it's just a play on a different health risk race. If you're a Black person, you give yourself a point. If you're a male, you give you a couple of points. And if someone in your family has diabetes, you give another point. And we tabulate those numbers. It mirrors that test that you mentioned. And we have it on tablets also in the community. Since at the time I was the only lifestyle coach in our organization. And since then, we're training other lifestyle coaches because we want to expand it. We want people to benefit from that. So this is what we do. And it's fairly simple. And it's 1 in 3 adults are prediabetes. Just have to look around. If it's not the person on your left or the person on your right, then it's got to be you. So you got to do something about it.
Awesome. I like that. I like how you say you're out in the community. I love that. Dr. Dambita, every community needs someone like you. I like that. And you mentioned the organization. Can you share a little bit more about the African American Health Program? You guys are doing amazing work in Montgomery County. Do you mind sharing a little bit about the organization and its efforts in making sure that we can reduce the rates of type 2 diabetes in our community?
So we have a comprehensive view, something that you do not get when you have a one-on-one with your physician. We have to teach people, to educate people about diabetes. So the basic notions of diabetes is taught to them. And we have experts such as yourselves to come and preach the gospel of diabetes. And that includes Dr. Vivian, people. So remember, she's excellent. And we have stress reduction is important. So we have a yoga class. The exercise that we talk about is also important. We have a Zumba class. And then we talk about the diet. We have nutritionist. One is strictly plant-based food. And people join it to learn how to make vegetable, palatable, delicious, wonderful to eat. And it sends us back to our ancestors back in Africa. I remember my grandparents never heard of diabetes before because they were eating a lot of vegetables. They were physically active. We have this comprehensive approach to it. The other things that we do now, we've received funding through the NIH Office of Minority Health to look at the other aspect. Support is very important. Families, and sometimes I say this to the public and they laughed. I said diabetes is a contagious disease. Is this guy crazy or what? Telling about diabetes being contagious. Then I said, well, look at it. You probably, if you're within a family, you share some genes already. You all watch TV together. That's what good families do. So sedentary life. You eat the same food. So if one person in a family has diabetes, chances are that someone else has it. And when that happens, the person with diabetes struggles alone. There's ignorance about what the disease is, and you have to, so many things. The life of a person with diabetes is a complicated life. Getting the family involved is important. So the new initiative that we'll be launching is a research protocol. Is if you brought family together, if the intervention is for the entire family, not just the individual with diabetes, what would be the result? So that's some of the things that we're doing in the area of diabetes.
That is awesome. You mentioned something that really piqued my interest, the family approach. And when we're talking about it, share with our listeners, are we talking about just those who already have diabetes, or is this an approach to try to get people who have pre-diabetes or increased risk of developing type 2 diabetes?
The index person is the family member that has diabetes. And then we ask that person to bring in a family member, a relative. We will have screened that person for prediabetes, and automatically we will enroll them in the prediabetes class, the DPP class. There will be assigned a community health worker that will stay with them, check with them weekly, making sure that they follow the lessons and the practices and so forth over the period of time. And we hope that they will support one another. And that's the key thing, how the family will support one another to improve their health outcome.
Beautiful, beautiful. Let's talk about some of the challenges with participation in the DPP program. A lot of the time, I hear people tell me, "Oh, it's too long. I cannot, believe how long it takes." And there's also some fear around weight. Some of the stigma, people feel like there is some weight shaming. What has been your experience like, and what are some of the barriers you've come across in the DPP program? Why people might be hesitant joining?
That is the length of time. CDC, to be recognized as a DPP program, the program has to run a full year. So it's a long time getting people. My first cohort, for some reason, they just gel. It's a group that they felt comfortable sharing experiences and so forth. And we had an excellent adherence, nearly 90% adherence. And for the first 6 years, they were showing, first 6 months, they were showing up weekly. And then we moved to twice monthly. And the last 3 months, it was just once a month. And then they graduated. Motivation is important. That's why we have a staff member calling them weekly. And they became so good about it. If someone is going to miss a particular session, they will let us know. And when that happens, we send them the recording of the session so that they
Beautiful.
keep up with it.
That is amazing. And in your program, do people have to pay to be part of it? Is there a cost associated with it?
It's absolutely free. Although many programs that you see around the nation, they charge something like $10 per meeting. So that comes up to about $500 a year. Our program is absolutely free to the public. Just join and make the commitment. We make you sign a pledge that you will, and we hold you.
There is
To that pledge.
accountability. Yes.
Accountability. And we have some incentives that we give them.
What has been your experience actually working with providers? A lot of people trust their doctors, everything sometimes the doctor says they do, right? So have you had a lot of success getting providers to actually refer someone who has prediabetes into your programs?
Yes, as a matter of fact, we have certain hospitals that do refer to us. They tell at discharge in the hospitals that this program is available. If they want to join, that's a passive way of getting them. But I think one of the things that we need to do is to actively get those have access to the people that may benefit from the program. And since it's absolutely free, they don't have to worry about insurance. They don't have to worry about the out-of-pocket expenses.
And I think that's one thing that I don't think we all take advantage of, the technology, the capabilities of technology. So I think there is still some work we all need to do in making sure that providers are aware of all the resources that are available to their patients out in the community. And you want to make sure as a provider that whatever outcome you want or you're working on, the person needs to be able to do it, right? They need to be able to, first of all, understand it, have the support they need and the resources when they get home. So I want to ask you, Brett, can people really benefit regardless of their background in programs like this? Can they really feel supported and also reap the benefits, not just for themselves, but for the entire family?
Absolutely. And in fact, this coming weekend, we will be doing a table at a Ethiopian festival in Montgomery County. That's what we do. And when they see that there's an African doctor, there's some African staff, some Black like them sharing information, that creates the trust that they sometimes need to nudge them. You should join us. So we're seeing more and more Africans and Caribbeans and joining, taking advantage of this the program. And I think this is something that probably needs to be considered at the national level because it was simple enough. I'm so passionate about it.
Thank you. That's amazing work you're doing out there. I truly appreciate it. And I'm sure everyone that you've touched, come in contact has been really appreciative of the support. One thing I wanted to ask you to share with our audience is if someone wanted to reach you and get involved, what's the best way? How can they reach Dr. Dambita and make contact and find out about the amazing work you're doing as part of the African American Health Program?
Okay, great. A couple of ways they can reach us. There is a website, African American Health Program, Montgomery County .gov. They can reach us, or they can call our phone number, which is listed. It's 240-777-1833. We'll put them in contact with the right person.
Beautiful. And we're going to include that in the notes as well. Thank you so much, Dr. Dambita. I am truly excited about the new approach you have, the fact that you're continuing the DPP program. I know you're going to come back to share more about the prevention efforts, how things are going, and all the best practices and lessons learned. So we always end with something positive. So what final words do you want to leave our listeners with?
The final word is hope. Hope, hope. I am excited. You should be excited that you can reverse diabetes, that you can do it easily. You do not have to make major sacrifices to your lifestyle to achieve it. So please join a group, find out more about diabetes, and go get tested. Go get tested. Take the risk test. Get in touch with it and stay in contact with Dr. Vivian.
Thank you. Thank you so much. Truly, truly happy to have you on the podcast today. Dr. Dambita, we are going to share the contact information, the link for you to do the pre-diabetes test, know your risk for type 2 diabetes, a lot about your program. So really important information about DPP and how to find one in your community. We will share all that important information as part of this episode. I cannot thank you enough, Dr. Dambita. It's been amazing getting to know you, being part of your program, and I cannot wait to see all the amazing things that you're still going to do as part of the African American Health Program. So thank you so much. I'm truly honored you decided to join us today.
I am one thanking you. Merci beaucoup. You're quite
There we
welcome.
are. There we are.
All
And
right.
thank you. That concludes our podcast for today. If you like this show, please leave us a review, share this episode with friends and family. You can also find out about past episodes by just making sure you sign up for the podcast. It's available on Spotify. We also have a YouTube channel where you can also get more information around diabetes and other conditions as well. You can follow us, I mentioned, on Facebook, Twitter, Instagram. We're there. If you have any question for Dr. Dambita, please submit your questions and he will get you the answers you need. Truly grateful. Thank you so much for being part of this podcast week after week. And until next time, remember your health matters.